Welcome back everyone to RX2010 Week 3. This is Part 2. We're going to pick up where we left off. We're now going to talk about what happens when we need to calculate the dose when what the doctor ordered is not what's available in stock. We've talked about this a little bit before. It's one of those things you can kind of think about it like going into your kitchen and what's in your cabinet or your refrigerator. That's not going to change. However, your recipe can be changed. You can adjust your recipe to fit what you've got available. So that's kind of what we're doing when we're talking about dosing in a pharmacy. So a couple of reviews, just some information about the formula. The formula is order over stock times the dosage unit. Order refers to the amount that the doctor ordered for a single dose. So it's what the doctor said for one dose. Stock means the strength of the medication that we have available. So it's the strength. Dosage unit means what does that strength come in? Is it in a tablet, a capsule? Is it in 5 milliliters? Is it a puff? What is it located in? Now the thing to keep in mind is that your order unit and your stock unit must be the same units of measure. So if one's milligrams, the other one has to be milligrams, and so on. So those are just some things to keep in mind as we use this formula. So let's take a look at an example. This one says what quantity should be dispensed if 50 milligrams of amitriptyline has been prescribed daily for 3 weeks if the medication listed below is all that's available. So we have to start with the dose before we can figure out how much to dispense for the entire course of therapy. So we're going to start by calculating the amount for the single dose by using our formula, and it's written up here again just in case you forgot. So first is the order. What did the doctor order? The doctor ordered 50 milligrams, so that's what goes on top. When we go to our shelf, we find that the medication we have is only 25 milligrams. So that's what goes on bottom. It's 25 milligrams per tablet. Tablet is our dosage unit, so that's what goes here. So 50 milligrams divided by 25. You're going to do that in your calculator first. Hit your equals button. You get 2 times 1 means you're going to need 2 tablets every time they take this medication. And if we go back and read, they're taking it daily, so that means 1 time per day for 3 weeks, and 3 weeks is 21 days. So that's where we use our dose times our frequency times our number of days to find the total quantity to dispense. So 2 times 1 times 21 gives me 42 tablets that we're going to dispense. Okay, let's take a look at another one. This one is an example of an IV medication, and it's asking how many milliliters of stock dopamine must be added to the IV solution. Well, the prescription says that the patient is to get dopamine 400 milligrams added to his 500 ml bag of normal saline. So we have to figure out how much dopamine to add if the doctor says to give him 400 milligrams. Again, we're going to use the same formula. The doctor ordered 400 milligrams, so that's what goes on top, what he ordered. The way the medication comes in stock, the stock dopamine is 80 milligrams per 1 ml. So the 80 goes on the bottom, that's the strength, and it comes per 1 ml. That's our dosage unit. Now we're ready to go ahead and do the math. 400 divided by 80, hit your equals button, you're going to get 5, and then 5 times 1 gives me 5. So it's going to be 5 mils of solution that I'm going to have to draw up and add to that IV bag. So it works the same whether we're talking about an oral medication or an IV medication. Here's another question. It says how much codeine is in each dose of codeine phosphate oral solution 15 milligrams per 5 mils. The 15 milligrams per 5 mils comes directly off this label right here, and that's just telling you how much codeine is in every 5 mils. Now, we need to know what the doctor wants them to have because we already know what's on the label. The doctor wants them to have 2 tablespoons by mouth as needed for pain. So the first thing you're going to want to do is to convert your tablespoons to milliliters. We know that 1 tablespoon is 15 milliliters, so 2 tablespoons is going to be 30 milliliters. So we converted our tablespoons to milliliters first. Now what we want to know, the question is asking how much drug is in 30 mils of solution. How much drug is in that dose? So I wrote my question on one side of my proportion, 30 mils over in milligrams of codeine. And then from the label, I put what I know about the medication. That in every 5 mils, there's 15 milligrams of codeine. Cross multiplication, 5 times N is 5N, and 30 times 15. 30 times 15 is 450. And we divide both sides by 5, just like we always do. Whatever's with the letter is what we divide by. And we found that there's 90 milligrams of codeine in every dose that this doctor has prescribed. Okay, calculating day's supply is something that a few of you have had some struggles with. A day's supply simply means how long will the medication last if the patient takes it the way they're supposed to. So this particular prescription is saying that the patient needs Pamelor 75 milligrams. I go to my shelf and that's what I've got. I've got Pamelor 75. So I don't have to do any kind of calculations to figure out how many capsules to give. I can just follow the doctor's orders. So the doctor said to give 2 by mouth twice a day. If I'm taking 2 by mouth twice a day, that means they're getting 4 every day. And the doctor said to dispense 50 capsules. So the definition or the formula for day's supply is the total amount dispensed divided by the total amount taken in one day. In this case, the amount dispensed was 50 capsules, and they are taking 4 per day. When we divide 50 by 4, we find that this medication is going to last 12 and a half days. And it's important to note that when we talk about a day's supply, we typically only talk about whole days. So in our computer, we normally would put that this would only last the patient 12 days, because that half a day doesn't mean that the medication is going to last another whole day. In other words, we have to make sure we fill this prescription for that patient again before the 13th day. So when we talk about days supply, we always talk about whole days. Okay, here's another practice problem for you. Here's a Proventil inhaler, and when you read the label on the inhaler, it tells you that it has 200 inhalations. Anytime we're talking about this type of medication, you'll see them referred to as inhalations or puffs. So in this case, it's inhalations on the actual label, but the doctor says to use 2 puffs twice a day. So that means they're using it 4 puffs a day. So we can't ever break up an inhaler. You either dispense the whole inhaler or you don't. So we're dispensing 1 whole inhaler. And this particular container, again, this comes right off the side of the box, says that it contains 200 inhalations. So if we want to calculate the day's supply, we have to divide the number of inhalations, what's in the actual container, so 200 inhalations, by how many of those inhalations we're going to use per day. And remember, a puff is the inhalation. So we said 2 of them twice a day is 4 puffs, so that's what goes on the bottom. So 200 divided by 4 gives me 50 days. So this prescription should last 50 days if used as directed. Okay, when we start up again on part 3, we will be discussing strengths based on percents, and we'll be looking a little bit at dilutions. So I will meet back up with you then.